in, you should be able to see our screen. And so we're going to go ahead and talk about civic engagement in healthcare. It is a timely conversation after the last few weeks and the time that we're in. And so we'll let folks kind of join our space and we'll go ahead and get started shortly. Wonderful. Welcome in, everyone. As you're coming in, if you're signed in as Monte resident, if you could please change your name to your actual name for this round in particular. We want to make sure that we're able to keep the space safe for our speakers, who unfortunately it has become difficult just with the topic of voting, and so we want to make sure that we are doing that. Okay. So I am going to go ahead and get us started shortly. Okay. Welcome in. Okay, so we'll go ahead and get started. Good afternoon, everyone. My name is Stella Safo. I'm going to be presenting and moderating these rounds. And so thank you so much, all of you, for being here. If there are any of your colleagues, your friends, your fellow faculty, community members who are not here, who you think should be here, send them a note to get them into the space. And we are going to go ahead and get started. Excuse me. So our social medicine rounds, as you know, are really a time for us to be in community and to have a conversation together. And I just want to confirm, just because my computer is being a little funny, that you all can see my slides and it says social medicine. Is that right? Yes, I see some head nodding. Wonderful. Our social medicine rounds are a time for us to come together, to invite community members, to invite faculty, staff, medical students, both in the Bronx, in New York City, and all over, to come together and to really think about the issues that affect our community and affect healthcare nationwide. And so we cover a wide range of different issues. You can see some of them featured here. If you're interested in more, you can go ahead over to the DFSM website to see some of the topics that we've covered in the past. We are particularly excited about today's topic because we had our speakers join us last year to kind of preview this, and we're going to be going a little bit deeper this year, and are really glad that we're able to do that with you all. Can I just ask if Heather Dyer is on the line, if you can come off mute for me? Okay. So I'm not hearing Heather, so I'm going to go ahead and I'm going to stop screen share. I'm going to go ahead and I'm going to introduce our amazing speakers, two individuals who I am so consistently impressed by in terms of what they bring to this space, what they're able to do, kind of what they offer us in terms of thinking about civic engagement in healthcare. So our first speaker is Ms. Jeanne Ayers, who is an RN and MPH, who served as the Executive Director of Healthy Democracy, Healthy People. And that's a coalition of 11 public health organizations that's committed to advancing health and racial equity by strengthening civic and voter participation and ensuring access to the ballot for all eligible voters. Before this, Ms. Ayers held a leadership position in state governmental public health for over 9 years. Jeanne is a leader in this effort, particularly in health and racial equity work to improve population health. And she was selected in 2010 by the University of Minnesota as the Human Rights and Social Justice Award winner for her work. She's led equity initiatives in the faith-based organizing group Isaiah, and she's launched Healthy Heartland. Jeanne describes her work as building power to assure the conditions necessary for health are available for all. And she sees civic participation as an inclusive and important function for all of us to be a part of. Next is Aliya Bhatia, who is the Executive Director at Vot-ER and Civic Health Month. And she works to bring voter registration into healthcare settings, including emergency rooms, hospitals, and community health centers. She completed her master's in public policy from Harvard Kennedy School, and she's a graduate of the School of Foreign Service at Georgetown. Aliya was drawn to the connection between health and democracy through the combination of being raised by parents in the medical field and various defining experiences while studying, teaching, and working on housing and health initiatives. She started her career as a high school educator and then as a consultant for BCG. So she resides now in DC, and she works to realize Vot-ER's vision of healthy communities powered by an inclusive democracy. She's a Georgia native, but she's worked in Louisiana, Alabama, Mississippi, and Missouri, so a wide frame. And then I'll just tell you all my background in this conversation is really as one of the co-founding members of Civic Health Alliance, which is invested in increasing civic engagement in healthcare. And so the way that we'll run our rounds today is we'll go ahead and get started with Aliya presenting. And Aliya, I'll bring you up. And then we'll move over to Jeanne to myself, and then we'll move to Jeanne. It is our usual kind of request from you all. Please put questions into the chat. If you're joined as a Monty resident, please change your name just because these rounds are a little bit more sensitive. We want to make sure we know who's in the room. Jessica will be sharing resources throughout to really help you to kind of locate yourself if you're interested in more information as it comes in. And with that, Aliya, please take it away.
Hi, everyone. And I just added a quick note about where I'm calling in from to the chat. And if you wouldn't mind doing the same, just so that I can get a sense of geographically how many folks are calling in from New York City, how many folks are calling in from beyond. It would just be lovely to hear about that. It is just a delight to be back with Stella and with Jeanne at another pivotal time. I think that last year, if we look at some of the work that at Vot-ER and Healthy Democracy, Healthy People and Civic Health Alliance, so much of what we're able to do this year is in part because this group that is in this room has probably been at a few events that we did last year and helped us prepare for that. And so just very, very grateful to be here with you again. I want to share a bit about a number of topics, and I'll be doing this through the lens of my role at Vot-ER, and at the same time really speaking broadly about the connection between voting and health. And in order to do that, I'm going to talk about a couple topics, but in order to do that, I want to start with a bit of a story about how I came to this work. The fall of 2019, I'm from Atlanta, Georgia, and I was in a leadership program where they asked you to go on a ride-along. And you could do a fire ride-along, a police ride-along, or an emergency medical services ride-along. And I ended up doing my ride along with the emergency medical services, and in the dead of winter 2019, go on this ride along with a EMT who we are very different people. We're from really different parts of Atlanta, different generations. We think about politics differently. And as I'm going on this ride along, I'm seeing through his eyes probably something that y'all see every day in your work as health practitioners, which is that I was seeing all these social determinants that his team was expected to respond to. His EMTs were responding to homelessness. They were responding to food insecurity. They were responding to situations where someone's insurance changed and all of a sudden what used to be a medication they could afford, they could no longer afford, and now it was an emergency. And at the end of this ride along, I turned to this manager and I'm like, if I give you a magic wand and you only get to wave it once to fix this absolutely overwhelming situation, what is your one thing that you would do? And he said, Aliya, if I could only change one thing, I wish all my patients would vote. Because if all my patients voted, our local elected officials would invest in the right different elements, affordable housing, jobs training, grocery stores in every neighborhood. And when I needed to get someone an ambulance, I would have the money to get them one on time. Well, what this manager, this EMT really understood is something that, so much of the research has shown, and I'm going to share one aspect of it, and Jeanne's going to share many more, which is that voting is such a critical determinant of our health, because upstream of those social determinants, there are structural and political determinants or drivers of health. And Daniel Dawes, who wrote The Political Determinants of Health, names voting as one of arguably the most important of those political determinants. And this EMT knew this not through any research that he had done, but from observing his community and spending time in community with the families that he was serving. And it was about a month after that ride-along that I heard about Vot-ER and got involved in the broader civic health movement that Jeanne and Stella and so many others have been leading and are a part of, and been able to get involved in this work. Why does it matter that we think about voter registration? There's so many ways to get involved in civic engagement. It turns out that 72 million Americans are eligible to vote, so they're citizens, they're over 18, but they're either not registered or they're registered at the wrong place. It's really important if we want people to have a seat at the table that at the very least they're registered to vote, because that gives them the ticket to be able to then cast their ballot. And we want to make sure as many people are registered to vote at their current address. When we dig underneath that 72 million and we say, hey, you're over 18, you're an American citizen, why aren't you registered? 62% of those folks say, I have never been asked. They don't have a recollection of being asked. In particular, even though there might be some automated process at their Department of Motor Vehicles, they don't feel personally connected to that state of being a voter or being a registered voter. And it's so important that we make sure to at least ask the question in as many spaces as we can. And as health professionals, 83% of Americans are going to see a health professional this year. The same folks who you see in your health spaces are often those folks who are unregistered eligible voters, young folks, low-income folks, and folks of color. And so you have a unique opportunity and a unique surface area with the number of times that you engage with people to be able to support them around voter engagement and voter registration. And many different organizations, including the American Medical Association, recognized this link. And in 2022, the AMA recognized voting as a determinant of health and a critical one for us to pay attention to. So within this broader concept as voting as a determinant of health, there are many different things that we can do. Vot-ER is just one of many opportunities for the health field to push this work forwards. I'm going to share briefly a couple things from kind of like the Vot-ER sort of like platter of things to do, some different ways to get involved so that you have those. And I'm so excited for you to hear about Civic Health Alliance, as well as Healthy Democracy, Healthy People, and our collective effort around We Will Vote as additional ways to get involved. At Vot-ER, we provide Vot-ER badges and lanyards to our health professionals, which help them ask their patients directly about registering to vote. We provide custom digital materials for teams and organizations. And then importantly, and I'll reference this in the what you can do now part of this, importantly, we also provide templates that you can put into your texting system, your electronic health record system, your email system that help remind people about the power and importance of their vote. We try and build all of our tools to be as undisruptive to the patient experience as possible, optional for both health professional and patient to engage in, and completely nonpartisan. For us, nonpartisanship is something that we fiercely hold as a core value of our work at Vot-ER, and it is something that we're really thoughtful about. We have secretaries of state from both sides of the political aisle on our advisory council. We work closely with elections officials, and we work really hard to make sure that all of our tools and resources are the most nonpartisan, undisruptive tools that we can find out there. And we are constantly shifting what those tools are as we notice important things about the nonpartisanship and speed landscape in our work. And what we ultimately do is provide different structures for hospitals, associations, community health centers to be able to engage in this. And right now we're actually in the midst of our Healthy Democracy campaign. So if you are a health professional student, we are in for the preseason right now, and I believe September 1st is the kickoff of the main season. And so I will drop a link later for medical students to get engaged there. What this can look like if you want to, ask a patient about voting. A lot of times people incorporate it straight into their social history. This is one way to do it. This is a pediatrician in Ohio who asked all of her 18-year-olds about this. Do you smoke? Do you drink? Are you wearing a seatbelt? Are you safe at home? Are you registered to vote? Is a way to include it. There are other ways on our site that you can get conversation starters that are research backed and supported by a minority-owned polling firm that we have built to help you. Quick legal FAQs. There's a longstanding precedent for 501c3 organizations to do this work. The 1993 National Voter Registration Act created a national framework for organizations, including nonprofits, including government agencies, to be able to support people with voter registration, voter education, and get out the vote. The most important thing is to stay neutral and nonpartisan. As long as you're within that boundary, it is permissible to ask people if they are registered to vote at their current address, if they are meeting the eligibility guidelines. And so a few quick next steps from our end, key dates on the horizon. Really big date. If you only take one thing from this presentation, National Voter Registration Day is September 17th. It is a de facto holiday where we get to celebrate the importance of voter registration. Use that as a time to use your platform to make sure that people in your lives and your colleagues amongst your patients are registered to vote. There's also early voting and vote early day. And remember, the last day to vote, the deadline to vote, is November 5th. We often think of it as election day, but what that obscures is that there's often many important opportunities to vote early. And I know y'all as health professionals, my mom, who is a physician, I get home a few days ago for a conference I was in Atlanta for, and she was like, here's my form for my absentee ballot. Can you help me fill it out so that I can make sure I get my ballot? That was what was on her mind, to make sure that she could vote. I'm going to send a couple things in the chat. One of them is now is a good time to get ready for National Voter Registration Day. I'll drop you some resources to prepare for that. And then as we get closer to November, we will have phone banking to reach people who have registered to vote. If you've done political phone banking before, this is not quite the same as that, because oftentimes in that you get people who have been called by too many people. We reach people who are not being called. You're their first person who is calling them, who is helping them make sure they know where to vote. These are folks who are not considered, likely high propensity voters. They're folks who are often low propensity and unlikely voters who we're helping them get over the finish line to be able to vote. I get unprompted text messages from people who come to our phone banking that is the best phone banking people have done, because they're really reaching people who are in need of support and help to be able to vote. So that is what I have for you. I'll drop some links in the chat shortly to be able to help with that. Oh, thank you, Jessica, so much for dropping in those things as well. So
Awesome. Thank you so much, Aliya. That is exactly kind of where we wanted to start. And our goal there was really to help everyone start thinking about this from the how do we operationalize, how do we move this forward, how do we do this? What I'm going to do now is I'm going to share a little bit from the perspective of what we think of when we think about civic engagement in healthcare, and go a little bit deeper in the kind of why healthcare and why now. And I'm just sharing slides from Civic Health Alliance, which is an organization that we co-founded because in 2020, we had individuals, myself and 3 other physician friends, have folks walk into our clinic rooms and basically say, like, doc, I don't feel safe voting for different reasons. One of them was just being worried about getting sick with COVID while they were waiting online to go vote. And so we started as both Health 2020 back then, as a grassroots organization, really just interested in giving people guidelines around how they could show up to vote and vote safely. And one of the things that was really kind of impressed upon us that Aliya spoke of was this kind of dearth of resources and focus on the healthcare sector being involved in this work. And so when we got past the 2020 elections of helping people get out and get out to vote, we actually organized ourselves into a more formal structure called Civic Health Alliance. We became a 501c3 recently. And our goal is to really pull ourselves together as a nonpartisan coalition of health and civic leaders who are invested in advancing America's health through civic engagement. I'm going to define for you what civic engagement is. And again, I think it's really important to think about the importance of voting, the nonpartisan kind of work of voting, and to also think about other ways of advocacy that I know we in healthcare often feel very strongly about, given what we see and what we deal with our patients. And the case for civic health is really one that's tied to addressing health determinants. And we know health determinants as all of the factors, the non-biomedical factors that impact individuals' health outcomes. We also know that as communities gain power, and they grow more cohesive in terms of kind of an increase in their civic engagement, they're better able to determine the factors that impact these social determinants of health. They're able to put in sidewalks, they're able to avoid having food deserts, they're able to put in, safe laws and reforms and policies that keep their neighborhoods safe. When we think about where this maps to in terms of kind of communities that are engaged, that are showing up and being civically engaged and able to vote, it often reflects that those communities that kind of have some of the highest burdens of social determinants of health factors are also the ones that are kind of the least able to be engaged for different reasons, or at least able to engage because of actual harmful voting practices. And I won't talk about that here, but we all know about certain communities that face longer polling times and less polling spots to be able to vote, more restrictive policies around mail-in ballots, or more restrictive policies around early voting, all of which can have an impact on the communities that are able to show up and be civically engaged. Just in New York, which I think is an interesting thing to think about, because we tend to think about red states and blue states, and obviously all of us are okay. If you think about the differences in the boroughs, and you look at the 2020 elections, you saw a difference in individuals showing up for the general election in terms of voter turnout. And so by almost 10% difference between those in Manhattan who showed up to vote and those in the Bronx who showed up to vote. And again, that maps to some of the kind of issues that we think about as clinicians. As a doctor, as someone who is, seeing patients, practicing, I think a lot about the kind of unique space that we sit in that I want to speak to, because I know sometimes when we talk to different groups, clinicians will say to me, like, you want me to add what to my extremely busy list of things to do. You want me to take care of all of these 7 health conditions, refill all these meds, and then get people registered. And so I want to just name and acknowledge that the reality of why we're talking about it in healthcare is one that's really worth engaging. And so we talk a little bit about the why and like review the why so we can know how much it's tied to health. We know that civic engagement, participation in civic engagement is tied to mental health outcomes, to education and income. Voting itself, those in a 250,000 person survey, those who tended to be more civically engaged in voting also reported better health. And I think Jeanne will talk about this in more detail. Civic engagement, if you look at it at the population health level, states with more inclusive voting policies also have better overall population health outcomes. And I'm not going to go into this in deep detail. We're actually going to do a grand rounds about civic engagement principles, and we'll dig into all these data in even kind of more exquisite detail. I want you guys to be able to get the breadth from the 3 organizations, but there's a deep amount of really interesting population level data from all over the world that looks at different forms of civic engagement, including volunteerism, activism, advocacy, voting. One of the things that's challenging about this is like what falls under the umbrella of civic engagement. And so that's something that's kind of worth evaluating. But it's been found that those who at a younger age are more civically engaged tend to have lower anxiety and depression symptoms as they age. And there's a lot of theories as to why this may be and how it maps over to this idea of building social capital and having more social supports. And so why healthcare? I was just talking to you all about, well, I know healthcare exquisitely. I know what it's like to be in healthcare and be feeling as though we're pressed to do more. And the why healthcare really is, if you think about what's happening around burnout. So we went from about 2011, a Mayo Clinic national study found that in 2011, about 44% of physicians were burned out. That was already terrible. To about over 63% in 2021. The numbers come down slightly to about 50% post-pandemic. And the things that are driving it are things that we know. But one of the things that's driving this burnout is the moral injury of feeling as though there are things that you're seeing that your patients are struggling from and that you're not able to address those. And so outside of the administrative causes of burnout and the timing causes of burnout, all the things that we know, there's also just this like feeling of like, as a clinician, as a doctor, as someone delivering care, I can't help my patients with those upstream causes. And so there's a desire to really kind of think about how do we bring this into healthcare? The challenge here is that there's no time. There's often a lack of resources for folks. And when I say resources, I want you to think about Civic Health Alliance and Vot-ER because we don't lack for resources. We often lack for access to those resources. And there is a lack of know-how. We trained in medicine. We know how to treat people. We don't necessarily know how to think about different policies around civic engagement. And yet we want to say, and what we want to really convey with this session is that there is so much that can be done that ranges from individual level things that can be done all the way to organizational to structural things that we can all participate in. And so civic engagement, we define it as all of the activities and all of the ways in which individuals and collectives of individuals participate in their communities and in public life in the service of addressing issues of public concern or improving community conditions. It's everything from voting, getting out the vote, holding a town hall with elected officials, all the way up to, running for office yourself to be able to have kind of direct access to power if that's of interest to you. It's really important for us to emphasize that all of the activities that we do, again, come from this space because we're in the healthcare space of being nonpartisan in our kind of focus. I want to shout out Montefiore in this work. Aliya talked about the ways in which they're right now engaged with over 500 health systems doing the work out there. We needed early on, at least for some of the health systems that we speak to really kind of offer some proof points of how this can be done and why it's important to do this. And one of those early proof points was offered by social medicine alumni Alicia Leggett and Manisha Sharma, who were in the family medicine program in the early 2010s. And they did this really interesting study with League of Women Voters, where they basically set up again, I'll talk about this more when we have more time. They basically set up kind of a proof of concept where they went into 2 of the family medicine clinics and they approached individuals sitting in the waiting room, and they were able to go through a whole process to take about 300 individuals approached and get about 114 of them registered. This is pretty incredible, right? People are in the clinic, they're already sitting there, they're already kind of engaged, and this work was able to be done and done in a way that showed that it can be done, that there was acceptability for it, that there was institutional support for it. This was all the way back in 2013. Imagine what can be done now. And we kind of, again, harp on the different reasons why we come to this and why we're thinking about this within the healthcare setting, because we know that when we see our patients who've been impacted by certain realities and challenges, like lack of access to healthcare that prevents them from coming in early for a diagnosis that could have been, intervened upon, that's often because of a policy that organizations like payers or health, companies kind of have to execute. Those policy decisions come from policymakers who are impacted by who we vote for and how we vote. And so we just think about this kind of connectivity in, and we say it a lot. We talk about the policy to health cascade quite often because we want people to feel like this is your lane. This is the space that we should be talking about as it relates to what individuals are really thinking about. I also want to note that we live in a time where individuals have a lot of distrust. There's mistrust, distrust, misinformation about healthcare, and there is quite a high degree of mistrust. New England Journal of Medicine article looked at this and really looked at this and found that the levels of medical mistrust are really high, but what is actually almost as high is still individuals' belief in their personal clinicians and their clinical teams. And so again, medicine has this very unique perspective it can offer. I won't spend too much time on this apart from saying that one of the things that we want to do at Civic Health Alliance is to really think about that resourcing piece and that ease piece. And so we have different resources that speak to that, and I'll call out two in particular. One of them is exactly what Aliya said about this kind of poster that we've created to talk about why it's allowed for healthcare settings to do this work. There's actually contention and confusion around that being the case, and it is law, especially those sites that are Medicaid, that take care of patients on receiving Medicaid benefits. And the second thing I want to call your attention to is, people often say, like, how do I do this? How do I kind of set myself up, let's say, to do a voter registration drive at my clinic? There's a resource that'll take you through that, how to organize it, take you to the different links to be able to download and kind of get yourself set up. And finally, one of the things that we offer, just like Vot-ER, because we think it's really important, is the actual content and resources that you'll need to be able to just give someone a flyer, give someone a little postcard. Hey, we won't have time to talk about it in this visit, but here's a reminder for you to register to vote or to give it to, your loved ones to register to vote. And it's as simple as that. And so I'm going to end with just reminding us that the kind of space that we really want to be thinking about is that civic engagement through all of these different organizations is really about a continuum, everything from voting to, kind of having more direct impact on the policy cascade. And I really want to emphasize that as you're listening, if you're someone who's sitting in a place of power within the organization and has impact on kind of strategy, there are things that can be done that are institution-wide directives that would have a huge impact. There are program directors who make sure that if there's no early voting available, that on election day there's a system available to allow residents to go out and vote. And so attendings will hold their pagers while they go vote. There's things that can be done on kind of a more institutional level to be able to meet these goals. And there's also individual things that can be done, simply printing and putting up a flyer for your patients to kind of be reminded of this. And we're tailoring this engagement to the time, to kind of where you sit within your institution, and then just being acknowledging of the fact that we want to make sure that you're in a culture where this is accepted and not kind of putting yourself in a place where it may be challenging or damaging. And so with that, I'm going to go ahead and just remind y'all, I forgot to tell you in the beginning, if you just put in vote.org, especially if you're calling from somewhere that's not New York or from the East Coast, it's definitely worth checking your voter registration. There's all kinds of different stories about things, that are happening when people are getting kicked off. And so you can either point your phone to this QR code and just take a quick look just to make sure that you're all registered and you're all set, or you can just go directly to vote.org as you're listening to Jeanne come up and just double check that you are all set. Okay. And with that, I'm going to go ahead and turn it over to Jeanne. And thank you so much for your time. Jeanne, we are ready for you. And again, we'll take questions at the end, so please feel free to add them into the chat. Jeanne, if you're talking, we can't hear you. So I'm gonna ask you to
Oh,
start
turn on my
again.
mic. How's that?
There you go. That's better.
I just already said thank you and how much I love being on working with you as colleagues and being here today. So Healthy Democracy, Healthy People is a coalition of 11 national public health organizations. Along with our allies in moving the health sector more broadly, like Vot-ER and Civic Health Alliance and those in the election space. We, as Civic Health Alliance did, actually initiated and began our coalition in 2020. And let's see, how do I go forward? So the reason is, as public health and broadly, I mean, I love the content that Stella and Jessica and Aliya has shared, because you're talking about what you can do as individual providers in clinical settings. And I'm going to be talking about what we do collectively, because public health is what we do collectively to assure the conditions so that all people can be healthy. I have a question. Is this little bar that says I'm sharing my screen showing on anything else?
I can see your screen. You're good.
Yeah, but is this little bar also there?
No.
Okay, good, because it looks like it's there for me. So our overall purpose is to come together and build our collective power to advance health and racial equity through civic and voter participation. Healthy Democracy, Healthy People uses 3 practices to do this. We organize people and organizations like the coalition that I'm talking about, and bridge relationships with organizations like those that are on the call today. And we organize and focus on moving policy and resources. So we take actions to implement policies and resource investments that will create change at every level in the system. And I will provide some examples of that. And finally, we organize our narrative and the research and the data so that we can lift up the connection between voting and health outcomes. And we do that through research and policy statements, but it's a huge important part of our work, all of us here on the call, to build the public understanding and the political will to promote inclusive access to the ballot and civic participation. And part of the reason for this is that, as Stella alluded to in the beginning, is that some people might want us to feel like even saying the word vote is partisan. And it's important that we bring the data and the broader understanding that that isn't the case, and we help be the storytellers and the champions to go beyond that. Our coalition is sort of grounded in this basic understanding that health and democracy are interdependent. Higher levels of civic and voter participation lead to more influence and power to influence the policies that create health, and then lead to better health outcomes. But the important thing to remember here is this is a virtuous cycle, but it can also go the other direction. So if we have low civic and voter participation, we end up with less power to influence the policies and poorer health outcomes. And that is how, and one of the ways that voting and civic participation are then mirror the same health disparities that we see showing up in our clinical settings. Over the years, I have become really clear that if you think about our health as our health is almost 80 or 90% influenced by our policy environment or the conditions that create health, then you have to add in this other aspect, which is having the power to influence those conditions. So in our collective practice, we need to be strategic about having the power to influence those conditions. Whenever we have expanded electoral power throughout history, we see an improvement in our health outcomes. So for example, after women got the right to vote, child mortality rates declined by 8 to 15%. In the 20th century, the civil rights movement ushered in a more inclusive voting across races, in particular African-American population became more fully enfranchised. And that ushered in more inclusive policies in education and housing, economic opportunity, and Medicare and Medicaid. And also there's been recent research that shows that the Voting Rights Act itself led to reductions in Black infant deaths and differences in infant mortality in those southern counties that were covered by and subject to pre-clearance. In 2010, after the Affordable Care Act was passed, advocates organized to assure Medicaid expansion. So these are examples and times where having more full representation helped create a different set of policies that improved health. But I want to just flag the fact that every step forward, all these steps forward were contested, and that when you're in this space, it's a continuous struggle for power. And sometimes we wish it wasn't. We wish it was just like forward progress, but that's not been our experience. In 2020, we had this historic turnout across the electorate. Every single group voted at a higher level than we had seen before. And it was a moment that we should have been celebrating. I thought we should be celebrating. We were very excited, a bunch of public health people trying to be sure that people didn't not come out to vote simply because we had an epidemic or a pandemic. And when we should have been celebrating that historic turnout and the fact that we had no COVID outbreaks related to the election, we were confronted with this struggle for power where the narrative about voter fraud was being amplified in all these spaces and creating a set of energy and political energy for policies that made it harder to vote. So in 2021, the Health and Democracy Coalition came together to say, well, what can we do about this? One thing we can be doing, and I'm inviting all of you to be part of this, is tell that bigger story with the data of the importance of inclusive and representative democracy for our health outcomes. And so the Health and Democracy Index, we did this analysis, and in 2021, it compares 12 public health indicators that we often use, like overall health, self-reported mental health, infant mortality, 12 indicators to the policy environment, to the restrictiveness or ease of voting across all 50 states. So we connected the policies to the health outcomes and looked at all 50 states. And we discovered that there is a very, very clear pattern that states with more voting access and greater civic participation have better health outcomes. So on the vertical axis, and you can look this index up and you can play with it because there's all different ways to sort here, but each of these boxes is a state, and I put a star around the New York box. And on the vertical axis, it's better or worse health. And on the horizontal axis, it's less voting access and more voting access, and that's those policy environments. And you can see this pattern. And when you sort through on this index, you can see this pattern by specific health outcome, by state, by policy arena, and it's just a really consistent pattern. And one of the things I want to highlight here is it's not just the individual act of voting that's creating this pattern. It is actually the policies that are communicating whether or not we are inclusive and we want people's voices heard, or whether or not we're excluding people. I just want to highlight quickly some of the policies that are included in this policy environment. No excuse mail-in early voting, inclusive voter registration, automatic voter registration, online and same-day voter registration. When we're enabling voter registration and education in service settings, like the ones that Vot-ER and Civic Health Alliance are doing, the ones that you're practicing in, policies that expand access in that way, non-strict voter ID, and reinstatement of voter rights. All these policies are related to improving population health. So following the 2021 publication of that index, there's been a fair amount of additional research that's been coming out now. So there's a 96 to 2020 analysis looking at that, looking at the ease or difficulty of voting across for self-reported health, and it reinforces the findings that we talked about. We also see that states where it's easier to vote have lower uninsured rates. And the counties where it was easier to vote had lower pre-vaccine COVID case and mortality rates. And I mentioned already, southern counties with Voting Rights Act protections had significant reductions in Black infant deaths. And Stella mentioned that when people vote vote early in their lives, that especially adolescents and young adults, it's positively associated with better future income, education, and mental health. So one of the things that we can do, and I mentioned that we work to try to create system change at every level and do this through through policies and resources. And when we move beyond thinking about voting as an individual act, and you think, what can we do? Aliya mentioned that the AMA passed a policy. The American Public Health Association passed a policy. The American College of Physicians, Society of Public Health Educators passed organizational policies to announce and to say and to communicate that working to provide the education and or outreach or advocate for inclusive policies is part of our work as health professionals. So that helps create the norming that is necessary to become healthy democracy champions, along with doing the analysis like the index. At the state and local level, you can join efforts to promote policies to expand access in some states, Minnesota, Michigan. There are teams of people who have been showing up in the policy setting environment at the state legislative level to bring the health data to the conversation where people are working to protect and expand voting opportunities. At the national level, and this is kind of fun, we were able to get Healthy People 2030 to include voting as a health objective, a national health objective. And what that does is it allows us to be encouraging our state health agencies, where I was a state health officer, and we do state health assessments and state health plans every 5 years or so. And now we can say working on voting is part of that work. When you're in a nonprofit health care delivery system or insurer, now it can be part of the legitimate work that we are doing in those spaces as well. And so you can actually show up to bring your voice to those decision-making spaces when those plans are being considered and developed. And this is just this is what it looks like on Healthy People 2030. Increasing the proportion of voting age citizens who vote is a health action. It's one of our core objectives now. But again, this struggle has been contentious all along. I mentioned that the unprecedented turnout in 2020, and yet even though we had that turnout, 33% of eligible people didn't vote that year. And in 2022, only 46% of eligible voters voted. And then since 2020, we have all these new limits. At least 28 states have added new restrictions that were not in place in 2020. And so this is a really important time between now and voter registration day in mid-September to be talking to everybody you know, like, did you check your voter registration? Are you registered? Because some things have changed in some places, and we want to be sure that people are registered and can get out and vote. And now here's the thing that I just think is so important for all of us to know. Healthcare workers make up 14% of the US workforce, and yet we are voting 12 to 23% less than the general population. We're voting 12 to 23% less than the general population. Did you see that number I had above here that says only 46% of eligible voters voted? I just, on my own math, think that means somewhere between 8 and 11 million healthcare workers, licensed healthcare workers, are not voting. And And I want to, we came together, our three organizations, to work to change that. And we launched an effort in February with the National Academy of Science, Engineering, and Medicine called Thrive Through Civic Health, We Will Vote. And we're basically, and right now we have about 65 organizations signed on. I'm sure you can't read these words, but you can go find them on the website. And 65 representing over 100,000 members or employees in these organizations who've signed on as organizational champions. So the organizations themselves have signed an organizational commitment that says, as a leading health organization, we commit to strengthening our democracy and encouraging nonpartisan voter participation across our organization. And when you do that, all the various resources that Civic Health Alliance and Vot-ER have just mentioned, we'll be sure you get those, and in addition, more things, social media kits and all of those things, so that you can easily inform your employees and your members. So that's something you can do to get your organization. But then as an individual, we can always remember that health is always on the ballot. We make a voting plan, invite colleagues and friends to make a voting plan, promote opportunities for civic and voter participation in your workplace, and invite colleagues to learn more. And there's this, and you can scan this little code as well. This QR code brings you to a pledge to vote that just says, I'm going to vote, and I'm going to encourage my neighbors or whatever and friends to vote. And you can just check those off and you'll get reminders. One thing that we learned, or we know about signing such a pledge like this, is that actually increases the likelihood that you will vote, and that other people will as well. So that's our invitation to you. Thank you.
Awesome. Thank you so much, Jeanne. And so we are going to turn it over to our discussion. As always, please feel free to add any questions that might have come to mind as Aliya, Jeanne, and myself were presenting. I will go ahead and play moderator for us, just because I think that there's some topics that come up, and one of them is a hard topic, and I think it's an important one for us to just kind of get out of the way, especially if we're thinking about what it looks like for us to be working with populations that have been historically marginalized. And so there are realities and there are issues and there are challenges that people feel very strongly about, that they feel like no political party is listening to. And so when we as health professionals and individuals in the healthcare space are talking about voting, that might be off-putting. And so and even to some healthcare workers who just feel disengaged. And I'm just curious what you would say, in response to a program director who may be interested in doing this work, who's a little bit nervous about that. And maybe Aliya, I'll turn it over to you first, and Jeanne, if you have anything else to add.
Yeah, absolutely. So we actually just refreshed some of this with some external experts on specifically that topic. And the pieces that I will just share briefly. It's really important, if the person is skeptical, to acknowledge the skepticism and to validate it. One thing that we advise people to do is actually say, why do you vote? And like, why does the person who's convincing the other person, whether it's like Stella convincing a health professional to do this work or the health professional convincing their patient, actually naming why do you vote, and actually what is important to you about it. And then naming, really importantly, I think that because of the way that campaign finance works in the US, all of the advertisements that we typically get are for federal elections and for like statewide elections. Mm-hmm. It's pretty rare for you to see the material about the dog catcher, the town clerk, the city councilor, the people who are the public health board. But those are the folks who are going to decide, how clean is the water in my pipes? Do I have a grocery store in my neighborhood? Is there money for affordable housing? All these different determinants of health. And so naming how important those are. And then there's this line from, you have to decide in the circumstance whether it's right for the audience, but with young folks, there's this research-backed line that worked really well in Brazil in 2022 during what felt like a similar election cycle to them. And that was, in that time, it was two older candidates who people, generally knew and felt were old faces. And one of the things that really resonated for young voters was this line of, if you don't decide, someone else will decide for you, as being adding on to all the positive language, but that landing really well for a lot of people. People don't want to give up their agency, right? They want to have good choices, but they definitely don't want to give up their ability to choose. So those are a couple of the different things that we point to, and within this week that will all be updated on our website on the conversation starters page.
Awesome. Jeanne, would you add anything?
I would only want to second what Aliya said. I think that sometimes we've leaned in on this idea that it's a duty, and I don't think duty motivates us that much. I mean, I think people are tired of duty, especially in the healthcare, or we're working already, we're doing our duty. But when you think and lean into the idea of what do we do collectively? How do we build the strength collectively? I think we're really at an early stage of recognizing the health sector as a potential muscular group of people. We don't act like that. If we're not even showing up to vote, how would we expect our priorities to show up in the settings that we care about? And I think that that's just a quick, I said 22 million people are in the health sector. Auto workers are like 4 million, but you sure hear about the auto workers, but you don't hear about the health sector. And teachers are 3.8 million. So imagine what happens when you and your colleagues begin to vote and show up and be allies with the people that you're caring for. It's pretty exciting, I think.
I want to ask, I like how you said something about duty and kind of thinking, bringing back kind of more joy into this. I want to know from both of you what makes this work hard and what makes this work fulfilling, because I think, I want to be honest with the folks that are listening who are like, I want to do this, but what's in it? And, like, I think that this can be somewhat challenging in certain circumstances and spaces. It's more time, it's more effort, but also there's things about it that are so brilliant and wonderful. And so, Jeanne, maybe I'll start with you of like, what has made your work joyous and fulfilling, and what do you find that has been challenging or difficult about it?
I think it's really fun as more and more people recognize that this is work that can make us healthier. And it helps us connect with our overall aim of assuring the conditions so that people can be healthy. How do we do that? And that's like a big thing. What can you do? Well, here's a simple thing I can do to assure the conditions. So it's like an accessible action that I can take, then I can take with my organization and or my colleagues. And that just feels like I'm doing something that's helping. And it is a antidote to depression or to discouragement when you're part of doing something. The flip, did you want to hear the flip? It's the thing that makes it sometimes hard is that you feel like you're doing the same thing over and over, saying the same thing, trying to and it's only 4 years that this organization has been around. So we have to look back and say, my gosh, we made a lot of progress. We got all these organizations to pass policies. We got the Healthy People 2030. Civic Health Alliance and Vot-ER are getting all these individuals to do this work. We are making progress, so you have to celebrate that.
Well said. Aliya.
Yeah, I love this question. And Stella, if you don't mind, it'd be lovely for you to also answer it, if that's okay.
Oh, I will. Don't worry.
I'll start with the challenge and then the flip is the joy. The challenge is how anxious health professionals get around digging into questions and asking these questions with patients. And then the joy is when they come back and tell me, none of my worst nightmares have ever happened on this. Like, I was anxious without, much of a reason to be anxious, or I was anxious and, didn't realize that this was something that, my patients are going to welcome. And this last weekend, I was at the National Association of Community Health Centers conference, and one of the health professionals from Ultimate was sitting next to me. He was like, yeah, in 6 years, like every once in a while, I'll get like a disagreement about whether it's important to vote, but I don't get like nastiness or pushback or anything that would like stop me from feeling it's valid to ask the question. So yeah, the people's apprehension versus the reality. The apprehension is the challenge, but the reality of joyfulness and agency and giving in a way that is beyond the walls of the health space is something that we always hear wonderful things about.
I love that. I love that. I appreciate both of your responses. I think what I would say that is a challenge for me is, you know, when I have a lot of these conversations with different groups of trainees, with faculty, it breaks my heart to see how disempowered we feel as a profession. And I'm speaking specifically about clinicians and you know, physicians who I tend to engage with. Because exactly as Jeanne has said, there are so many groups that have taken on their power, and maybe it's because they're unionized, or but they just see themselves showing up and standing kind of 10 toes down in defense of their rights and the groups that they kind of represent. And it makes me sad, I think, to see the ways in which I think medicine is an incredible calling and an incredible profession, but there's something about it that feels like it does take a little bit of the spine from us by the time we get to our kind of, you know, terminal years and terminal degrees. And so it similarly is very inspiring when people kind of find their voice and they find their kind of sense of agency in this. My joy, always, I think about this one patient of mine who in 2020 was wheelchair bound, really nervous to go out and vote. And we like talked through a voting plan. We worked with him about how he'd get his health aid to go and kind of set everything up. And he was able to vote. And after, you know, the election, he was just so happy that he got that. And he passed away shortly after that. And I just remember him, and I remember that he brought into the space with me this request: Doc, can you help me make sure that I get to vote this election season? And he's who I think about when I feel, and I take care of patients with HIV, and sometimes I feel very, very squeezed, like I have no time, and I don't want to add another thing. And I'll think about this patient in particular, about the joy that comes from assisting people to just feel as though they're able to use their voice and use their agency. So thank you, Aliya, for encouraging me to answer that. I want to open it up to folks. I'm just going to be silent for a moment to see if anyone wants to come off of mute to ask a question directly of any of us or to make a comment. You're welcome. So I'll do that for a minute, and then I'll go ahead and continue to ask questions. And just so folks know, we'll go until about 5:45. Questions or reflections for our guests?
Can I ask a question if I'm not jumping ahead of anyone?
Yeah, we can hear you, Dr. Gonzalez. Go ahead.
Hi, thank you for such a wonderful, informative webinar. Um, I appreciated the data on when large swaths of our population were more fully enfranchised, how health outcomes changed, and I'm excited to play with the website that you shared. Thank you. Can you give us some examples? People say all politics is local. I don't understand how to contextualize that for people. Like if this neighborhood voting goes up, voting rates go up, even on a specific, you know, that probably be driven, but hypothetically, what does that mean? Because sometimes I wonder if it just feels too like distant from people's day to day, to help engage people and get the buy-in why this is so important.
Excellent. I feel like, Aliya, that's your wheelhouse. Do you mind repeating the question quickly and then just taking that one?
Yeah, and Christina, I'm gonna Dr. Gonzalez, I'm gonna empathize with you around like how do you package this up concisely? We're still working on that too. So like the packaging part of it, I think is you know, more challenging. I think the question that was asked around like the question that was asked, as I understood it, was what is sort of the direct link around like more people voting and like changes in our communities, and how do we like articulate that? So I'm gonna get at the first part, and I'm not gonna be able to do as good of a job on the second because we're still like working on that packaging. The thing that I will share with y'all that I think is really important is that when we look, whether it's globally around the world or in the US, when more people vote from a wider range of backgrounds, more money is invested into the things that we consider these social determinants that are the 80% of our health. And that like research basically shows that happens in nonpartisan elections. It happens in elections that the same person might win. But what has changed is that elected official is like, okay, now I'm not just responsible for that 5% that usually vote for me, but I'm responsible for everyone in my community. There's something around accountability that plays a really defining role in pushing the way that people like take action. And so that's what I'll share, is that it's part of this is not just about, you know, who you vote for or whatnot. It's also about who does that politician have to win their second reelection from who are they going to care about? Are they just going to care about white, wealthy homeowners? Or are they going to care about renters, folks of color, lower income folks? That really depends on the range of people who vote. I hope that's helpful. And I know it's not a silver bullet for the question.
Jeanne, would you add anything?
I would add, unfortunately, a sadder story about it. And that is, I had a conversation with a person who worked in a mayor's office in a very community where there were a lot of health inequities and there was no healthy food access. And in that role in the mayor's office, she worked to create with the mayor to get healthy food in there. And they were successful. They got grocery store, they got community garden, they got these things. And when the next election came around, they lost. And when they did the analysis, something like only 13 or 14% of the people in that community that they had worked so hard to serve actually voted. And so we think about what roles we can take to change the social determinants. And then maybe we even go out with an altruistic idea that we're going to do this thing. But it's not something we can do for people. People have to demand it. We have to do it together. We have to co-create the conditions in our communities. And one of the things we can do is champion the policies that make sure that the voices are heard. And you know, that's so it's kind of a flip from Aliya's story.
I think where I love kind of what you're pulling up, Jeanne, is the importance of the conversations that happened as part of our civic engagement activities. We talk a lot about voting because it is it's the most innocuous of all the things that can be done. You can't argue with someone for getting out the vote and voting, right? But there's also, I think, others, I know, right? We live in a world where people argue with you for that. But there's also, I think, a step further where, you know, we as healthcare professionals and in the healthcare space, and this is me wearing my hat as Civic Health Alliance, Vot-ER can't kind of say this, but we can say it as Civic Health Alliance, talk about civic engagement and what that includes. And, you know, there are folks who are partnered with us who say, like, we want to make sure that our community members are in conversation with their local elected officials. And so we want to hold a town hall. We want those people to come and have the conversation about what they have done. So people can see, people can feel, people can understand, and we can be in that kind of co-community, co-creation and alignment to avoid, you know, what you've described. And so I just think it's a moment for us to think about, you know, if getting out the vote and voting kind of isn't your jam, there are other ways that we can use our spaces to really bring this forward. The third thing that I'll add, or the second thing, I've lost count, that I'll add is that elected officials also love to make visits to health centers. It is, I suppose, a great photo op, and also just so that they can report that they're, and so, you know, at that time, that's, I think, a space where we can really think about what are the issues that my community members are bringing up to me that I want to just be a voice for, because I'm wearing this white coat, I'm standing here, they're coming to visit, and I want to be able to kind of put something forward that speaks to the needs of my community. Those are all incredible ways of thinking about protecting the health of those that you serve. And so just kind of expanding out from what we've been discussing around voting for those who kind of are thinking about other ways of advocacy, I want to mention that as well. Thank you, Christina, for that question. I think that was really helpful. Other questions? We're going to wrap in a couple of moments, and I want to see if there's any other questions from folks who are on the line or comments. Wonderful. So let me ask another question that just relates to the approach for this. So one of our Monty alumni, Dr. Robin Reister, actually is at Dell in Texas, Dell University in Texas, doing some really excellent work around organizing individuals. And she, in 2020, I think it was in 2020, she was able to do a get out the vote booth, no problem. In 2022, she asked and she was told no by her leadership. And they said that they were concerned about, I don't know, some language that they use basically to say no. And so my question, starting with Jeanne, is, you know, how do you suggest approaching leadership to be able to do the kind of work that we've described? And I'm asking you, Jeanne, kind of to start, just because you do so many conversations at the high, you know, population level with big institutions that are representative of hundreds of thousands of members. You know, what's the approach as you kind of come into these conversations, and how do you deal with the no's when you get them?
So when I think about creating system change, you have to think about system change by thinking about the system like the level above and the level below you. And so when you're thinking about getting someone in an individual clinical encounter, that's one level of a system. How do you facilitate that change? But to make that possible, you have to get the possibility to happen in the organization. And what I've learned and continue to see is the level of risk aversion of the organizations to encourage or allow this type of work. And that was one of the reasons we came out and said, we have to have a chorus, like this data on the Health and Democracy Index, the research that's come out since then. We need a chorus of people saying and telling this story that inclusive voting policies make us healthier. And we have to stand strong. We can't abdicate that space. And part of why we did that index initially was in late 2020, people started to say, we can't say the word vote anymore. And I'm going, we can't not. How can we do anything? How can we be about health and health equity if we can't make this clear? And so sometimes, and I feel for your friend in Texas, because Texas is the hardest state to vote in. It was already the hardest with policies, and that's before a set of new policies was just implemented. They just threw off like 1 million people off the rolls. They don't even know they're off the rolls. They added additional barriers. They took out polling places and things. So that's a tough place. So, but to be able to stand on their professional, platform, when they know that the AMA and the American College of Physicians and their colleagues in all these other spaces are doing it. That's why those things matter. I think the policies and then the healthy people, but you can't just go straight into Texas and expect things to get better as an individual. You've got to figure out how to engage a broader set of partners. We have to build our collective muscle, and we've got to bring a lot of people along to do that. And I think that would be, I don't know if that really answers the question, Stella. It is a real thing. That's all I say. I mean, there are people who sometimes even our allies are not allies. People in our professional fields who you think should agree, and then they're just not courageous about it. And it encourages when you have to be strategic and do things with other people to make it happen. You can't just go be the one provider in your building, like waving the thing around saying this is really important. You've got to get a team of people. You got to get them to get to the next set of people. You got to get competition always matters. If something's happening other hospital, then they want to do it in their hospital too, or their system, so that cross system organizing is just really important, I think.
Wonderful. I want us to leave folks with some final thoughts. And I would love, as you're sharing them, if you could share a word that describes how you feel about the state of civic health in the United States. And I'm happy to start while you guys get to think about it. So my word is weary, because I don't feel quite hopeless, but I also continue to feel not quite optimistic. And when I say weary, it makes me think that we have work to do, and I want to do that work to really be able to, as you've all described so beautifully, change our approach to how we think about the connection between our civic engagement and the health outcomes of the populations that we take care of. And I want to leave folks that are listening kind of with this idea that we acknowledge how busy and intense and hard it is to just provide clinical care, to just be a med student, to just be a staff person, to just kind of be living. And we know that we carry a degree of privilege that I think should inspire you, if you are aligned, to push a little bit to do what you can. And the groups that are on this call, Healthy Democracy, Healthy People, Vot-ER, Civic Health Alliance, are designed specifically to make it easier. And so I really want you to walk away from this with a sense of like, it can be done. Yes, some of us are weary, but we are doing it despite that weariness. And there are resources and there are supports, and we can do it as a collective. I will turn it over to Aliya. Would you like to go next?
Happy to. I'm in a slightly different place. I'm really fired up. Over the weekend, like we have one of those, if any of you are familiar with Slack, we have a Slack bot that anytime somebody fills out like a form asking for resources for their institution, it like pings one of our channels. And just over the weekend, like people would open it and be like, there's 10 notifications of like new organizations that want to get involved. And so I think I take my hat off to, those of you in the health community who, despite being weary in the way that Stella just mentioned, are also continuing to do the work, and particularly new folks who are joining in to do the work and folks who are showing up yet again for another year. And to go back to something that Jeanne said, in 2020, 1 in 3 eligible Americans still didn't vote. I'm a former school teacher. That's between a D and an F, depending on which scale that, right? So we haven't even seen the potential of this country with true record turnout. We've just seen it at 66%. And what can we do if, we're able to raise the bar of what that record looks like and make that a regular streak, a winning streak for how we show up as a country. And through that, so many of you are maybe not as much on this call, but many folks are in states where you can make the system better. I'm in DC, where we have the opportunity to vote on ranked choice voting, which would change the way that voting works, make it that my voice counts a lot more, regardless of my political perspective or party. And I'm just very excited that there's so many of those ballot measures out there this year. So it's mine.
Awesome. Thank you, Jeanne.
I first of all, I'm excited that you have 30 people currently still on this call, and knowing that we have this low turnout in the health sector means that if you have 3 or 4 conversations with people, you'll be expanding the electorate. If you just talk to your colleagues, your friends, your neighbors, your family, you'll be expanding the electorate. And I want to, I don't know, maybe the 3 of our organizations look like we're big, but we're not.
No.
We're really, really small. And we just decided to do this work. So I'm going to call you back to the Margaret Mead quote that never doubt that a small group of thoughtful, committed citizens can change the world, because really it's the only thing that ever has. And so 30 people really would be something like, would multiply that. That's 120 people that maybe wouldn't have voted if you just had these conversations. So that's what I'm excited about.
I love it. I love it, love it. And so with that, I want to thank you, Jeanne. I want to thank you, Aliya, so much for being here. I want to thank the folks that are on the line for being here as well. I just want to think, again, about the things that we can do. You all always get a follow-up email that has a recording and has a ton of resources. This is one where it's really worth spending the time looking at some of those resources and printing out one flyer that goes up in your waiting room. Obviously I'm here also with wearing my hat as a social medicine lead. And so happy to talk more if there's larger, organizing that people are interested in doing. With that in mind, we are complete. The survey will be in the link and has been, so please continue to fill it. We'd love to hear from you for future round topics, reflections on these rounds. Our next rounds will be September 24th at 4:30. And we just, again, want to thank you all for being here and for your time with our speakers. Take care, everyone.
Thank you.
Thank you, thank you, thank you.